In the spring of 2016, Boise State University reached a historical milestone and graduated its first doctoral students from the School of Nursing. Graduates of the DNP program are successful leaders who exemplify the critical role of nursing professionals in transforming and shaping healthcare in the 21st century. Joining us to share her experience as a graduate of the DNP program is Claudia Miewald. Claudia is the Director of Behavioral Health at Kootenai Medical Center in Coeur d'Alene, Idaho. Let's talk about what motivated you to pursue your DNP.
So the reason I was motivated to obtain my DNP was because I saw it as an opportunity to really increase my knowledge that I could apply directly to my work in my organization, and as I work with regional stakeholders and also statewide stakeholders in the issues that are before us with care integration, particularly in the behavioral health arena. Because the beauty of the DNP program is you're able to tailor your projects that it can be meaningful to your work that you're already doing and really enhance that work. So that really appealed to me, to be able to do that and have that application directly to my clinical work.
I want to talk about that a little bit because that does seem to be one of the real true gems of the program is tailoring it, like you said, but also the flexibility that comes along with this. Walk us through that a little bit.
Well, in my set of circumstances, I was able to choose a DNP project that was something that I was already working on in my clinical world, and that was the creation of a crisis center for the mentally ill. And so my work in the DNP program, I really believe, influenced how we built the Northern Idaho Crisis Center, and also affected some of the outcomes that we see today, which have been, we've decreased emergency room visits, and that has been a cost savings to the community, as well as I believe we have truly saved lives. We've had individuals come back to us and say, if you weren't here, I wouldn't be here, and that is very powerful. And I really believe that a lot of the work that went into creating that center was born out of the work in this DNP program, that I had lots of encouragement and lots of advice from faculty, and it was very powerful.
I think that this is such a unique program here.
Yes.
What do you see as the real strengths of it?
You know, I looked at a number of programs when I was considering really throwing myself into this work, and what spoke to me about Boise State is the faculty support, the faculty input, and the accessibility to faculty, and also going through the program in a cohort. I know there's a number of programs where you don't have to go through in a cohort, but doing that work really helps you, I think, learn in a special way. And what that special way is, you have the support of others that are going through the same things. You can bounce ideas, and I think the learning is much richer because you learn about each other's projects and you learn about other ways of thinking about the same issues. And I think that was very, very valuable. So I really appreciated the cohort model. And so that was one of the reasons why I also decided to go through Boise State for the DNP program.